Yes, it's time for Mark Meets, in which I speak to the biggest names in the world of politics, showbiz, sport, business and beyond. Tonight, I'm joined by Dr. Ismail, Britain's top brain surgeon, who has opened a hair transplant clinic and is saving men from wigs. This is an amazing story, performing open skull surgery in the morning and restoring bald men's pride in the afternoon. Dr. Ismail, welcome to GB News.
Thank you. How are you, Mark? You okay?
I'm very, very well indeed. Great to have you on the show. How did you make the transition from brain surgery, in which you're the best in the country, if not the world, to restoring the thatch on men's heads?
Well, quite an interesting story. So I was phoned by a colleague of mine who runs a hair transplant clinic, and in his very peculiar way, he said, "Ismail, you can scalp people, can't you?" Were his exact words. And I said, yes, I can. And he asked me to go over to his clinic and get involved with hair transplant surgery. And initially, I was quite reluctant, hesitant, didn't really want to get involved. I was too busy. And after a bit of perseverance, I said, all right, let's go and have a look. So I went to have a look. And the results that I saw and the difference in the lives of those patients who were having restoration surgery or hair loss treatments was just phenomenal. It's a different kind of world, different kind of reward to what I'm used to experiencing in brain surgery. I thought, hang on, let me try some of this, and then I got absolutely hooked on it. And so now I spend probably still a fair amount of my time with brain tumour patients, brain epilepsy surgery, brain trauma patients, so doing a lot of operating on that side, but also a significant proportion now doing hair restoration work.
Well, it's obviously life-changing for those if you can restore their thatch. Why is it so important for men in particular to have a full head of hair? Why do they struggle with baldness, so many of them?
It was interesting because I think some people really accept baldness. They're not really fazed by it. But you're right. There's a stigma that's been attached to having hair treatment or hair loss or any kind of cosmetic surgery for men in general. But I think because it frames your face, and especially if you start losing hair when you're young, then it really affects their confidence, their self-esteem, and it has a real impact on them. And so when you can change that, and you can change that fairly relatively with, not particularly invasive surgery, I think it makes a huge impact. And I've seen people's confidence just suddenly rocket up, and it's so rewarding seeing that.
So what's involved? Tell me how it is that you restore hair to a bald man's head. So
if you've seen a very bald person, you'll realise there's a horseshoe of hair, band of hair, that never falls out. And the reason for that is it's slightly genetically different. The receptors are slightly different. And so you never, ever lose that hair, no matter how bald you get. And so all we're doing is we're not giving you new hair, we're moving that hair from that kind of horseshoe band of area to areas where you've thinned out at the front. And so there's a couple of ways of doing it. There's the old-fashioned way, the scalping technique, as I was initially attracted to. So you cut out a strip of your scalp, stitch it up, so it's a bit like having a facelift at the back of your head, so you don't really see much, so your neck's a bit tight. And then you cut that into individual hairs, and then you plug them into the front of the head or wherever you want it. The more modern technique is where you extract individual hairs across, again, the same region, but you're kind of thinning through the back of your head and then thickening up elsewhere. And you move the whole kind of, you don't move just the hair shaft, it's the whole root from the underneath the skin, the whole bulb, the root, a bit like moving a whole plant, essentially.
How effective are the results? Is it just a kind of a very sort of shallow wash of hair across the head, or is it a full Diego Maradona?
No, so a lot of patients will come to me and say, look, I want to look like I was 16. And my usual line is, look, I'm not going to make you like Chewbacca. If I could, I would. I can't. So it's about giving that illusion of density. Now, most men will not realise that they're losing hair until you've lost about 50% of your hair. So you don't really need to transplant much to give that look of coverage. So, but usually most men have enough reserve at the back of the head to be able to get a reasonable difference in what they look like. If we start running out of hair from the back of the head, then we can take from other areas like your beard or from your chest hair. And I've had all sorts of various requests to take from other bodily parts, which I refused.
Sometimes I've seen some hair transplants, and the the quality of the hair sort of looks different, almost a bit like pubic hair or something. I have to cite Wayne Rooney, where it looks more like a sort of bit of a mini beard rather than hair. What do you think's going on there?
Absolutely. So I think that's because again, the hair at the back of your head is a lot coarser than what you would get at the front of your head naturally. So it's important that the clinic that you go to really picks out the very fine single hairs for your front few rows to give it that softer look and that softer appearance.
Right.
But you're absolutely spot on, absolutely right that it is a lot coarser. It does look a lot thicker, especially if it's not planted right.
Right, yes. Now, how many procedures are we looking at your clinic to restore hair loss?
Well, it depends. So it really depends on the amount of hair loss. And just listening to what you were talking about with vaccines earlier, prevention is better than cure. Yeah. So if you can stop that process earlier on, so as soon as you start noticing hair loss, there are medications out there that would stop you losing hair. And if you can get to that phase where you haven't lost that much, so you wouldn't need as much of a transplant. You might just need one procedure. But if you're very far gone, then you would need multiple procedures. You'd need at least 2, maybe 3 procedures to cover the whole head.
And once you've done the procedure, once you've moved the hair root to the top of the head, you don't need pills or anything?
It depends which stage you are at your hair loss. So if you have a reasonable amount of hair, but you're thinning through it and you're progressively still losing hair, then you need to stop that process. And so you would need pills for that. Okay. But there comes a stage, men lose hair essentially because of testosterone, one of the byproducts of testosterone. And as we get older, certainly as I get older, my testosterone levels are probably dropping. So you don't need as much of a blocker. So by the time you hit your 50s, you probably don't need the medications anyway. Incidentally, it's the same drug that was used with patients with prostate problems. So men with prostate problems were given the drug, they suddenly noticed they were getting more hairier, and somebody went, hang on, there's money to be made here.
Definitely, bingo, ka-ching, ka-ching. Well, speaking of money, I know that you're the best in the business, but how much would it cost? Let's say someone that's just got, I don't know, sort of small degree of hair loss, and they go in to restore what's missing. What are we looking at? Is it thousands or tens of thousands?
No, so it used to be prohibitively expensive for most, but a small procedure will probably cost in the region of about, say, £3,000. But if you need a lot of work done, then yes, you could probably run up to about 8,000-9,000, depending on if you need multiple procedures, etc.
I see, but it needn't cost the earth. Let's get to my panel because they're all very gorgeously hairy. Let's have a chat with Mike Porky Parry, David Eldroyd Bolt, and Emily Lavinia. Emily, do you think that bald men are less attractive?
I think that's a question of taste, but I think the most important thing for anybody is their confidence, and if your hair or lack thereof makes you feel more or less confident, then go for it. I think for too long beauty standards have excluded men or been very divisive between men and women. I think if you want to look good, and looking good for you means having a procedure like the one that's offered, go for it. I think it's all about how confident you feel.
Michael, you're the ultimate silver fox. Would you ever visit Dr. Ismail's clinic?
Well, look, I think he does a very valuable job for people. And Doc, I think it's brilliant being a brain surgeon and putting hair on people's skulls. You go on both sides of the skull, don't you? Which is a fantastic talent and art. I have decided, many years ago, I will live with what I've got, okay? So if anybody doesn't like the fact that my hair is falling out, they can go and whistle, because it doesn't bother me. I am very happy in my own skin, very happy with my own head of hair. It's going a little bit at the front there, but I'm told that, as you quite rightly have called me, Mark, the silver fox, I've got a swathe of hair around the back of my head. And the most important thing to me, of course, is, do I remain attractive to the opposite sex? And I can tell you, confidentially, the answer is yes.
David, I'm sure there are plenty of Ismail's clients who would point to a picture of you and say, give me the full David Eldroyd Bolt.
Well, imitation is the sincerest form of flattery, so if they wish to do so, my fee is modest. I think it's a marvellous procedure. As has been said, it's about confidence, and if someone is, for whatever reason, hampered by their lack of hair in being the confident person that they feel they wish to be, and that would enable them to be more successful, whether that's in business or with members of the opposite sex, then by all means go for it. And I think the good doctor is doing a marvellous thing for anyone who wishes to indulge in this. And the fact that he's being paid well for it just proves that it's worthwhile, because if he weren't being, if people didn't pay the price, he'd have to drop the price. That's the beauty of capitalism.
Dr. Ismail, how can people find out more about what you do?
So I work at Wimpole Clinic, which is in Harley Street. So there's a website that they can access. And if they want a consultation with me, I'm more than happy to see them.
Brilliant stuff. Well, I'm sure you've got plenty of happy customers. I'll be seeing you in a couple of years or a couple of months if the economy takes a nosedive and I lose even more hair. Dr. Ismail Ughratdar, thank you so much for joining us. Top brain surgeon and also top expert in hair transplants as well. Brilliant stuff.